DSM, there's mention of different subgroups that tend to be identified in proportions of overall patients with depression. Now, depression runs with anxiety. And here we're at the Anxiety Depression Association of America, ADAA. The whole organization is devoted to these two major classes of mental illnesses. And why are they put together? Why is there an A and a D? It's because these illnesses run together. Patients with anxiety often have depression, and vice versa. Patients with depression often have some forms of anxiety. It could be generalized anxiety, where there are worries about many different situations. They call themselves worry warts. I worry about everything, worrying about minor matters, they may wake up just worrying, and they'll go the whole day worrying about specific things that may or may not happen. And the likelihood of most of the worries actually coming true is very small. So there's problems with handling uncertainty. There's distress from uncertain outcomes. And a chronic worrier, it can be incredibly distressful, taxing, can lead to depression. So anxious distress is a subcomponent of the larger MDD diagnosis. Mixed features we already talked about, where there's aspects of bipolarity with the major depression. Postpartum, so we're all familiar with postpartum depression. It's a very vulnerable period in that initial postpartum state, often due to fluctuations in hormone expression. There was recently an FDA-approved medication for the first time, specifically addressing postpartum depression, which is an exciting development for the field. And then many patients have seasonal depression, or what's called seasonal affective disorder, where there are reliable changes in mood, generally in the winter months, where there's an onset of depression, which then resolves itself by spring or summer. But there's a reliable pattern based on light-dark cycles and the seasons for the expression of depression. So when in that initial diagnostic session, when you're getting the diagnosis, it's good to also drill down. Do you have any of these subtypes? And there's other subtypes as well, not listed here, but these are some of the more common ones. And there's treatment implications for all of these. Anxious distress, you may think about sort of anxiety modification type therapies. There's a bunch of evidence-based therapies, including cognitive behavioral therapy for anxiety. You may think of, for panic disorder, for instance, you may think of specific focused psychotherapies for concurrent panic. Seasonal affective disorder, one of the most evidence-based treatments, in fact, is light box therapy, bright light therapy, which is the application of a light box, 10,000 lux intensity, applied every morning for a period of time to reset melatonin, circadian rhythms, and other aspects.